A new study finds women who start menopause before the age of 40 have a much higher risk of experiencing coronary heart disease in their lifetime. And joining me now to talk more about this link, we have Dr. Gleason, cardiologist with Sharp Memorial Hospital. I want to thank you, of course, for being here this afternoon.
You're welcome.
Okay, so this link between early menopause and coronary heart disease, is there a whole lot that we know about this link?
So we've known for years that if people have surgical premature menopause, such as an oophorectomy that might be part of a hysterectomy, that they definitely had a high incidence of cardiovascular disease at a much younger age. This study supports that women who go through a natural menopause at a young age also have substantially increased risk. And there are a lot more women who go through a natural menopause before the age of 40 than actually have a hysterectomy before the age of 40.
Right.
So this is a much bigger population.
And that is very early.
It is very early.
Very early.
So 50 would be pretty normal.
Okay.
Early menopause is 40 to 45, but this study shows that of the women who do go through menopause before the age of 40, they have a 40% increased risk of cardiovascular events earlier, and the early menopause has a 30% increased risk.
Wow.
And unfortunately for Black women, they have a 15% incidence of going through early menopause, and white women have a 5% incidence. So
do the hormones play a role in all this?
the hormones play a role in, as the estrogen declines when we go through menopause, we have more inflammation in the body, our lipid profiles change, not in a favorable direction, and that increases our cardiovascular risk long term.
Okay.
So we talked last month about the risks that women have that men don't, such as gestational diabetes, preeclampsia, polycystic ovarian disease, preterm delivery. And this is another one of those risk factors that isn't necessarily well known, that is called a risk modifier, increases our risk of events that we don't typically question about, and it's not in our risk calculators.
Wow. Well, now that we know that this is a possibility, if there's women at home and they're hearing this for the first time, what can they do if they may have some concerns?
So it's important that they be aggressive at modifying their risk, which means a healthy lifestyle, regular exercise, optimizing your weight, eating a healthy diet to optimize your lipid profile. And that's largely a plant-based diet, a Mediterranean diet, keep the processed foods and the sugar out of your diet.
Oh, gosh. And there's nothing to say about this being genetic at all or anything like that?
It's not really known why some women go through early menopause and other women do not. That isn't part of the study, and that needs to be studied more to understand that better.
Okay.
But it could certainly be genetic, there could be lifestyle issues, there could be socioeconomic issues that drive that.
Okay. As a cardiologist, or I mean, the more that you're learning about this, is any of this part shocking to you?
It supports what we've been learning over the years, but it also helps redirect me and to ask more specific questions of my female patients.
Right.
Did you have gestational diabetes? I wasn't asking that 5 years ago.
Ah, okay. All right. But I feel like it always goes back to, like you said, a healthier lifestyle. You take care of your body and see your doctor regularly. Ask the questions. Right?
Exactly.
Okay. Dr. Gleason with Sharp Memorial, we want to thank you for being here once again.
You're welcome.
Come back anytime.